You walk into a store with a headache, back pain, or fever, and suddenly the shelf looks simple until you actually try to choose. Because the bottles all seem familiar, the boxes look safe, and the words sound interchangeable. But they are not the same, and that's the problem. A lot of people think over-the-counter pain meds are basically just different versions of the same thing. Take one for pain, take one for fever, move on. But the active ingredient you choose can change 4 things fast: how well it works for your symptom, how long it lasts, what side effects matter, and what other medicines or health conditions make it a bad choice. So, in this video, I'm going to give you a simple label reading framework for 3 of the most common OTC pain meds in the US: acetaminophen, ibuprofen, and naproxen. Not medical advice, just a practical way to stop guessing at the pharmacy shelf. Here's the simplest way to think about this. These medicines may all help with pain or fever, but they do different jobs in different ways. Acetaminophen is commonly used for pain and fever. A lot of people reach for it because it's familiar, widely available, and often feels gentler on the stomach. But that does not mean it's harmless if you accidentally double up, especially if it's already hiding inside other products. Ibuprofen and naproxen are both NSAIDs. That stands for non-steroidal anti-inflammatory drugs. Basically, these are more useful when inflammation is part of the problem, things like swelling, muscle strain, dental pain, or certain kinds of joint pain. But NSAIDs also come with a different set of trade-offs, especially for the stomach, kidneys, blood pressure, and bleeding risk. So the goal here is not to memorize a giant drug lecture. The goal is to read the label in the right order, because most people start with the brand name, but the better way is to start with 5 things: active ingredient, what it treats, how long it lasts, warnings, and what else you're already taking. That's the framework we'll use. So we'll do this in 4 parts: what each medicine is actually for, the label reading system that matters most, the biggest safety mistakes people make, and a quick decision guide for common real-life situations. And by the end, you should be able to look at the box and think, what is this? What does it really do? And is it a smart choice for me right now?
Let's start with the high-level difference. Acetaminophen is usually thought of as a pain and fever reducer. It can be a common choice for headaches, general aches, fever, and minor everyday pain. But here's the important part. It is not usually the one people think of first for inflammation-heavy problems. So if the issue is more like fever, headache, or general body aches, people often compare acetaminophen first. If the issue is more like swelling, strain, inflammation, or certain kinds of injury pain, that's where the NSAID side of the shelf starts to matter more. Now let's talk about ibuprofen. Ibuprofen is an NSAID. That means it helps with pain, fever, and inflammation. So this is where things like sprains, sore muscles, dental pain, menstrual cramps, or inflammatory pain can feel more responsive. It's also one of the most common over-the-counter meds people already know by brand, which is why they sometimes take it too casually. Then there's naproxen. Naproxen is also an NSAID. Same big family, same inflammation angle. But the practical difference people often notice is this: it usually lasts longer. That's one reason some people prefer it for pain that hangs around, like longer-lasting aches or certain joint-type discomforts. So if you zoom out, the simple version looks like this: acetaminophen, pain and fever focus; ibuprofen, pain, fever, and inflammation; naproxen, pain, inflammation, and longer-lasting coverage. But don't stop there, because this is exactly where people make the first mistake. They hear works for pain on all 3 and assume the labels don't matter much after that. They do, because once 2 medicines can both help pain, the real question becomes what kind of pain, how often, what else are you taking, and what risk comes with that choice. That's why the label matters more than the front of the box. If you only remember one thing from this video, make it this: do not start with the brand name. Start with the active ingredient. Here's the thing. Brand names make shelves look more confusing than they really are, but the active ingredient tells you what the medicine actually is. So when you pick up the box, the first question is, what is the active ingredient? Is it acetaminophen? Is it ibuprofen? Is it naproxen sodium? That one line already tells you more than the branding. Second question, what does it treat? Look for the labeled uses: pain, fever, minor aches, inflammation-related symptoms. This part matters because people often take a medicine that is technically for pain, but not necessarily the best fit for the type of pain they have. Third, how long is it supposed to last and how often does the label say to take it? This is where a lot of accidental misuse starts. People think, this one wore off faster than I wanted, so maybe I'll just take more. Or, I already took something a few hours ago, but I forgot which one. That's how spacing errors happen. That's how double dosing happens. And that's how over-the-counter stops being low risk.
Fourth, read the warnings before you assume it's routine. This is the part people skip, but the warnings are where the real decision happens. For acetaminophen, one of the big issues is accidental overdose from taking it in more than one product. For example, people may take a pain reliever and then a cold or flu product without realizing both contain acetaminophen. For ibuprofen and naproxen, the warning section matters for different reasons. This is where you start thinking about stomach irritation, ulcers, kidney issues, blooding risk, dehydration, blood pressure concerns, and whether you're already taking other medicines that don't mix well. And fifth, check what else you already took today. This sounds obvious, but in real life, it's where people get caught. Maybe you took something for a headache in the morning, then later you take something for a cold, then something for a fever before bed. If you never looked at the active ingredient, you may not realize you repeated the same medicine. So here's the practical label reading framework in order. Active ingredient. What is this really? Uses. Is this the right match for what I actually have? Directions. How much, how often, and how long? Warnings. What makes this a bad idea or a stop-and-ask situation? Other meds? Am I stacking ingredients without realizing it? Basically, label reading is less about reading every word like a lawyer and more about asking the right questions in the right order. Now let's talk about the mistakes that matter most. Mistake number 1. Treating brand names like ingredients. People remember a familiar product name and assume they know what's in it. But different products can contain different ingredients, and combination products can hide more than one active drug inside the same box. Mistake number 2, doubling up without noticing. This is especially important with acetaminophen. A person may take a pain reliever, then later take a cold and flu medicine and not realize both contain acetaminophen. That's one of the most important label reading mistakes to avoid. Mistake number 3, using NSAIDs too casually. Because ibuprofen and naproxen are sold over the counter, people sometimes assume they're light duty, but sold without a prescription does not mean nothing to think about. If you have a history of ulcers, GI bleeding, kidney issues, dehydration, blood thinner use, or certain blood pressure concerns, that warning section matters a lot more. Mistake number 4, not respecting timing. Taking medicines too close together because you want faster relief is not smart label use. If the label says every so many hours, that spacing exists for a reason. Mistake number 5, using the wrong med for the wrong problem. If inflammation is the main issue, one option may make more sense than another. If fever or general aches are the main issue, your comparison may look different. And if you already have health conditions or take other medications, the best option may change again. And here's a 6th mistake that doesn't get talked about enough. Assuming over-the-counter means safe for everybody all the time. It doesn't. Over-the-counter means it's available without a prescription. It does not mean there are no trade-offs. That's why the smartest move is not which one is strongest, it's which one matches the symptom, fits the label, and creates the least unnecessary risk right now. So let's make this practical. If the problem is fever, headache, or general body aches, people often start by comparing whether acetaminophen fits the situation. If the problem is swelling, inflammatory pain, muscle strain, or certain injury-type pain, that's where ibuprofen or naproxen may be the comparison people focus on more. If the problem is lasting longer through the day, people often notice naproxen lasts longer than ibuprofen, but longer lasting does not mean better for everyone. It still has warnings, it still has trade-offs, the label still matters. If you are already taking cold and flu medicine, slow down and check whether acetaminophen is already in it before adding another pain reliever. If you have stomach ulcer history, kidney concerns, dehydration, take blood thinners, or have been told to be careful with NSAIDs, that warning section is not background noise.
That is the decision. And if you're standing there thinking, I still don't know which one is smartest, that's actually a good sign, because it means you're no longer treating the shelf like random guesswork. You're reading it the right way. And in some cases, the best next step is not taking another over-the-counter med automatically. It may be asking your pharmacist or clinician what fits your situation better. Especially if symptoms keep coming back, you need frequent doses, or you're managing multiple medications already. So here's the simple takeaway. Acetaminophen is commonly used for pain and fever. Ibuprofen and Naproxen are NSAIDs, which means they're often part of the conversation when inflammation matters too. And Naproxen is commonly known for lasting longer. But the real skill is not memorizing brands, it's reading the label in the right order. Active ingredient, uses, directions, warnings, what else you already took. That's how you avoid one of the most common OTC mistakes, taking something familiar without actually knowing what's in it. If you want, I can turn this into a simple one-page OTC pain med label reading chart you can screenshot and keep on your phone. Just comment label and I'll make it. Educational only, not medical advice. If you have severe symptoms, worsening symptoms, or questions about your medicines, contact a clinician or pharmacist.